Hello, everyone, and welcome. We are pleased to be with you today to do our residency program presentation for the Temple University Hospital Podiatric Residency Program for the 26-27 academic year. My name is Dr. Laura Sansasti. I'm the clerkship director for our residency program, and we have our 3 second-year residents here with us today to give the formal program presentation. So with that, I will turn things over to Dan, Daria, and Jess.
All right, hello. My name is Dan. I'm one of the second-year residents, as previously mentioned. Let's just get right into it. So, Temple University Hospital is a 3-year program in Philadelphia, Pennsylvania. We have podiatric medicine and surgery, as well as the added credential in reconstructive rear foot and ankle. Our home base is Temple University Hospital, which is in North Philadelphia, but there are a wide variety of other sites that we do cover in the area, including Temple's Foot and Ankle Institute at the Temple University School of Podiatric Medicine and other various private practices. Recently, as recent as this past month, we have started covering Temple Health's Chestnut Hill campus as an affiliated site. So with that additional site that we're covering, we now take 4 residents a year as opposed to the 3-year residents a year we were taking. And we also provide emergency department coverage at Temple University Hospital, which is a level 1 trauma center, as well as Jeans Hospital and Episcopal Hospital's emergency departments. So not only do we see a large quantity and wide variety of surgical cases, but we do pride ourselves on the quality of cases that we perform. As I previously mentioned, and it'll come up a couple times, we operate within a level 1 trauma center, so it gives us a wide access to a wide breadth of operative traumas and various pathologies. We have a busy consult service within Temple University Hospital and those previously mentioned sites. And then the bulk of our referrals and outpatient cases do come from the Temple Foot and Ankle Institute, where our attendings all practice in the clinical setting. So as far as forefoot surgery goes, we see a lot of bread and butter cases. You might hear people call them, whether that's bunions, hammer toes, MPJ fusions, soft tissue masses. We have been incorporating a lot more and more minimally invasive techniques into our work, whether that's kind of industry systems and techniques, but also kind of widening indications for MIS interventions as it comes up. And then for trauma and rear foot surgery, as I mentioned before, wide breadth of pathology that we're exposed to, whether that's open fractures, compartment syndrome, gunshot wounds, rotational ankle injuries. There's no shortage of trauma exposure at our hospital. And we also, as far as elective cases go, we do have a wide expanse of reconstructive rear foot and ankle procedures, including flat foot and cavus recons and Charcot reconstructions and things such as that.
Hello, my name is Jessica. So another point of pride that we have is our multidisciplinary diabetic limb salvage center, which our program faculty did help to found up at Temple University Hospital. So we have weekly conferences with the vascular surgery department to kind of devote our efforts to lower extremity limb preservation. These conferences include multidisciplinary management with other teams such as cardiology, nephrology, infectious disease. They sometimes join these meetings, but it is every meeting, it's us and vascular. And then, so here are just one of past resident surgical numbers. So this was after having completed our transition from a 4-year to a 3-year program. These numbers reflect the achievements of one of the recently graduated 3-year residents. So he accumulated 630 cases and 1,081 procedures. Important to note that he was one of 4 chief residents, and now typically we have 3, or currently we have 3 chief residents. So these numbers are likely diluted a bit from what we're seeing right now. It is also important to point out that with the addition of the Chestnut Hill Hospital, there's more opportunities to scrub cases, so lots of variety. And then to off-service rotation, so most of our time first year and second year is spent on service. That said, there are approximately 5 off-service rotations each year. So your first year, you will do infectious disease, emergency medicine, internal medicine, anesthesia, and pain. And then your second year, you will do trauma, burn, vascular surgery, as well as radiology, rheumatology, and psychology. Your third year is spent entirely on service with a built-in block up at UPMC Williamsport, as well as additional opportunities for electives if you choose to do so. And then some of these electives include repeating any previously completed rotation, additional surgical specialties or medical specialties, focused wound care and limb salvage, as well as spending more time with the UPMC rotation or private practice. All of the off-service rotations as well as electives are offered at the Temple's main campus. And then here is a more detailed layout of what your off-service rotations would look like each year.
So my name is Dari. I'm one of the second years. We have a pretty unique academic setup with a structured 36-month curriculum that's designed to cover possible topics to be covered on our surgical board exams. We also have dedicated boards preparation each month. We come up with boards questions ourselves based on reading chapters and literature that's assigned based on the monthly theme. We also have academics twice weekly, typically on Tuesdays and Thursdays, that include a variety of events such as journal club, radiology rounds, grand rounds, and sometimes socials, but also hands-on labs, which is what some of these pictures on the right are showing. This is what we call our surgical skills lab. It's the practice center for the advancement of surgical arts. It is something that we have access to whenever we want to fine-tune any hand skills. We also have open labs and practice with sawbones, hardware, K-wires, etc. We have an arthroscopic simulation as well for us to practice with that equipment. And we're always encouraged to go there when we can. What's nice about our affiliation with Temple University Hospital is right across the street is Lewis Katz School of Medicine. So we have access to their cadaver lab. And about once a month, mostly in the spring, we go there for regularly scheduled practice and surgical dissection techniques. So if you have a specific case coming up, you can practice that dissection, you can practice your closure, or just appreciating the anatomy. Our attendings and faculty try to be there to guide us, but we're also encouraged to practice these skills on our own as well. And it's convenient because it's right across the street from our call room. Our faculty have a wide scope of involvement within the profession, which includes nearly every professional organization such as ACFAS, ABFAS, AO, APMA, and BPME. And they are eager to help us find opportunities for involvement that match our individual interests as well. With respect to alumni, we have graduated residents who attended podiatry schools other than TUSPM. And we're exceptionally proud of the fact that 6 of our program alumni are now program directors and 1 is a fellowship director. And because of that, we have a robust network across the country. So if you graduate from this program, you'll likely have connections in any state that you want to practice in. Another area that we like to kind of brag about is our emphasis on our contributions to science within our profession. We participate in the scientific literature review with ACFAS annually, and we routinely investigate and publish clinical scientific findings in journals such as the Journal of Foot and Ankle Surgery and the Journal of the American Podiatric Medical Association. We also have the opportunity to present at major conferences such as ACFAS, ASC, APMA National, Regional Goldfarb Conference, etc. And we routinely participate in peer review for the aforementioned journals as well. So the nice thing is that we're affiliated with not just obviously Temple University Hospital, but also the school, TUSPM. So both these institutions are supportive of us attending major conferences and courses, such as ACFAS, the Annual Scientific Conference, APMA National, the Baltimore Limb Deformity course. Dan, Jess, and I just went to the AO Basic course a few months ago. Janine, Kavya, and Courtney are current chiefs. They came back from the Scopes course not that long ago as well. So if you have an interest and institutional approval, you can go attend these things yourself. We also get an annual educational stipend added to our paychecks that can be used at our discretion. And I think it really shows a dedication of our program to the advancement of our skills and service to the profession.
So just to show you kind of who we are, our team, I had mentioned before, with the addition of that extra site that we're now covering, we've increased our capacity from 3 residents per year to 4 residents per year. So our PGY1s are Paul, Jordan, Komal, and Jensen is pictured there. Daria, Jess, and I are on this call with you, but also pictured, and then our chief residents currently are Courtney, Janine, and Kavya. Another thing I did want to bring up is that recently the Temple House staff at the main campus, Chestnut Hill campus, and Fox Chase campus recently reached agreements on our first union contract. I'm bringing this up because I'm going to get into some of our perks and benefits on the next slide. So just showing how this kind of impacts that. So some of the included benefits include total pay increases over the duration of our union contract, increases in our yearly education funding, things like license and DEA reimbursement, protected vacation time and fatigue mitigation, among some other perks that we have as well. And so just getting to some of those benefits that we have, we reap the benefits of our affiliation with an academic medical institution. Our pay is competitive and it increases on an annual basis. These numbers are most up to date based off of changes with inflation and with the union contract as well. We also have paid health insurance with easy access through the hospital system and various locations affiliated with it. The previously mentioned $1,500 in CME money per year for educational expenses. We do, if we desire, we can get the title of adjunct faculty at the Temple University School of Podiatric Medicine upon graduation of residency, which is excellent to have on your CV. And then other things, whether that's free parking at the hospital and the school, meal stipends, vacation time that I mentioned before, and then access to all Temple amenities.
Alrighty, so this is just a little bit about like work-life balance. So these are just some photos of us doing some fun things outside of the hospital. So we try to get together to do, some seasonal activities. So you'll see us carving pumpkins like around Halloween time. We also set up some socials in place of some of our academic time. So maybe like once a month or once every 2 months, in one of our dedicated afternoon academic times, we'll do something else, go out to dinner or something like that. So yeah, and then next slide.
So I'm Andy Meyer. I've been the program director here at Temple University Hospital for 12 years. It's a job I take seriously, and I'm really proud of the residency program. I will say over those 12 years, I've figured out that there's some things that you can do and some things that you can't do as a program director. And I certainly view my most important job and the thing that I can do is to give opportunities to the residents. And the more opportunities that I can give them and the more they take advantage of it, the better residents we put out. And we are very proud of the residents that we've put out. So certainly not a week goes by, and probably every day I think about ways that we can improve the program for the residents and have them take advantage of more opportunities. So that includes surgery. We want as much quantity and quality and variety of surgery as possible. And we've been able to expand our affiliation agreements to different hospitals and surgery centers now in order to accomplish that. Clinical variety as well. We now have the opportunity to take advantage of a bit more private practice and community, in addition to the things that we have downtown, and with academics. As Daria mentioned, we have opportunities to be teachers. If you think that you want to be a part of a residency program someday, or you think you want to be a residency program director, I can't think of a program that provides more opportunities to kind of figure out your teaching style and to put that into play with our first, second, third, and fourth year students here at TUSPM, not to mention our externs. Again, as Daria mentioned, we also provide a lot of opportunities with respect to science and professional volunteerism. We have a lot of publications, we do a lot of posters, and there's really not an organization within the profession that we don't have somebody being an active part of. So if that's something that you think wants to be in your future, we are very mindful of that and provide you with good opportunities for that. So that's what we do now and what we'll continue to do in the future.
So if you do decide to clerk with us for the month, one thing I do want to make clear is that we don't only accept TUSPM students. We welcome students from all podiatric medical colleges. And we have certain expectations when you come here, such as a 2 to 3 5-minute presentations and 1 15-minute presentation per month based on the topic of the month at that time. We also don't like to sugarcoat things, so we'll make sure that you get like a full, like realistic idea of what a day-to-day in the life of a resident at Temple Hospital would be like. You would cover 1 weekday call shift, which is a 24-hour call shift, and part of a weekend call shift as well, with one of us. And we want you guys to be as hands-on as possible. So any surgery that one of us is scrubbing in on, the clerk would be expected to join. And we take a lot of pride in teaching every month. We like going over cases with students. So we want to make sure that they feel like they're part of the team.
So this is our contact information here listed on the slide. We appreciate you joining us today for our program presentation. Please feel free to reach out with any questions, and we look forward to having you visit and spend a month with the program. Have a great day.